See everybody over here, this side. This is the ventral aspect and this is the dorsal aspect over here. Okay. So this is the ventral root of the spinal nerve. This is the ventral root emerging out from the ventral horn over here. And this is the dorsal root going into the dorsal horn over here. Getting it on? So ventral root and dorsal root over here. Whenever they are emerging, whenever the spinal nerve will be formed and emerging out, it will be appearing. It will be appearing in this manner. Could you able to see that? Both the dorsal roots and the ventral roots will be joining and will be emerging out as a spinal nerve in this manner. You can see that the spinal nerve is piercing, as if it is piercing the dura mater, it is emerging out over here. Could you able to understand or not, right? So dorsal root from the posterior aspect and ventral root from the anterior aspect will be joined together and form a mixed spinal nerve. The spinal nerve will be carrying an elongation of the dura mater over here till it crosses the intervertebral foramina. You know the way is the intervertebral foramen, right? Between the two pedicles, there is a foramen in between the two notches. Whenever till it crosses it, it will be covered by the dura mater over here. So that is what you are seeing over here, this area. You can see, small projections. You can see these small projections. These small projections. Would you able to see that? This one. This is the spinal nerve which is carrying the dura mater over here. Would you able to see that? Spinal nerve is emerging out, piercing the dura mater over here. Would you able to see that? Right? See here, over here, this side, third over here. Now we are going towards the lower end of the spinal cord, which appears like a cone, which is also termed as the conus medullaris. Okay, see here. So the conus medullaris will be continuous with the phylum terminal. Okay, see here. Focus on this region exactly. Focus on this part exactly. So this is the lower end of the spinal cord. This is the lower end of the spinal cord. You can see that, right? This is the lower end of the spinal cord. What I'm holding over here is the lower end of the spinal cord, which is in the form of a cone. That is nothing but the conus medullaris. From below the conus medullaris, a layer, nothing but the extension of this phylum terminal. That is nothing but the phylum terminal. This is the phylum terminal. Whatever you are seeing from the bottom of the conus medullaris, this is the phylum terminal. Whatever I'm holding, it is the phylum terminal. Okay. So this conus medullaris, along with the upper 3 millimeters of the phylum terminal, will be having a dilated portion that will also carry the cerebrospinal fluid. That is termed as the terminal ventricle. We have already known two lateral ventricles, one third ventricle and one fourth ventricle. One is a terminal ventricle that is present at the level of the conus medullaris and also little bit, 3 millimeters within the pia mater. Okay, that will also carry the cerebrospinal fluid. That is the terminal ventricle. Getting it on? Remember, right? So you have to differentiate. In the examination, you are supposed to differentiate the phylum terminal from rest of the bunch of the nerves over here. These bunch of nerves are nothing but. There is no spinal cord over here. Cauda equina. So this is the phylum terminal, and these rest of the bunch of the fibers are the cauda equina. The cauda equina will be formed by which nerves? All the way from L2 till the coccygeal nerves. L2, L3, L4, L5, S1, S2, S3, S4, S5 and coccygeal nerves will be forming the bunch of nerves over here. How you will count the nerves all the way from above downwards? C1 nerve will be emerging above the first vertebra, cervical vertebra. C2 nerve will be emerging just below the first cervical vertebra. Getting it or not, right? From then onwards, every nerve will emerge downwards. For example, if there is a C4 vertebra, the below nerve will be C5 nerve. For the thoracic, what will happen? At the level of T1, for example, T1 vertebra, which nerve will be emerging out below?
T1. No, T1 will be.
Getting it or not?
There are 8
cervical nerves, so that's why there is a difference. Getting it or not? Whenever you reach the C7 vertebra, the nerve below comes is the C8 nerve, but below that will be the T1 vertebra. So from below the T1 vertebra, there will be T1 nerve. If you take the C4 vertebra, there will be C5 nerve below. But if you take the T1 vertebra, T1 nerve below. Getting it or not, right? So the corresponding nerve will be below in case of thoracic vertebra and cervical vertebra, apart from the first cervical vertebra. Getting it or not, right? But the succeeding nerves will be below the vertebra in the cervical vertebra. Getting it or not? If this is C4 vertebra, there will be C5 nerve below. But if it is T1 vertebra, T1 nerve will be below. Corresponding nerve will be just below. Okay, these things you are supposed to know. Okay. So the cauda equina will be formed by which nerves? L2 to coccygeal nerve. Okay, these will be forming the. So whenever you reach the sacrum, how the nerves will be emerging out? when you reach the sacrum,
The sacral foramina.
sacral foramina.
and posterior.
So 5 sacral vertebrae will be fusing together. So in between the first vertebra and the second sacral vertebra, there is a foramen. What is that foramen?
Anterior.
Anterior and posterior sacral
sacral
foramina.
foramina.
Within the first sacral foramina, which nerve will be emerging out?
S1.
S1, absolutely. Whenever you're reaching, because we are corresponding nerve will be going below from the thoracic onwards, isn't it? So whenever you reach the L4 vertebra, L5 nerve will be emerging out. Even though the spinal cord is ending at the level of the L1, but the L5 nerve will be going just below the L5 vertebra, or passing all the way through the vertebral canal and emerges through the vertebral foramen over here. Getting it or not? Understanding or not? Right? So similarly, the S1 nerve all the way from the cauda equina again starts from the lower end of the spinal cord and goes through the S1 anterior sacral foramina. Could you able to understand or not? Right? Could you able to understand or not? Right? So if this is the S1 vertebra, here will be the anterior sacral foramina, first sacral foramen. Through this, the S1 nerve will be coming out. S1 vertebra, S1 nerve will be below. Getting it or not? Right? And the meninges will be ending at the level of, apart from pia mater, the dura mater and arachnoid mater will be ending at the which level? S2. But the phylum terminal will end at the level of, or attaches at the level of coccyx. Which coccyx? Among the, if it is 4 parts, 4 pieces of the coccyx, which coccyx it will get attached? C1. Okay, C1. For the first coccygeal vertebra, the phylum terminal will be attached over here and fixing the spinal cord below. Getting it or not? Right? Okay. And one more thing you're supposed to see is the ligamentum denticulatum. Whatever I'm showing will be asked in the examination to show. Getting it or not? Could you able to see this triangular expansion, right? It's not that clear. See here. Could you able to see this triangular expansion over here? One sheath is okay. I'll show you much more better.